You're welcome, guys. So, this channel is just going to be about everything else, women health, men's health, and so on. Now, if this is the first time you are joining me, please do well to subscribe to my channel. And if you are following me on my Facebook page, please do well to follow this page. So, now I'm going to be talking to you about 3 reasons why your vaginal infections keeps coming back. Now, number one reason is that you do self-medication. Yes, most of you do self-medications, especially when you start noticing that, oh, there are scratches around your pubic area, around your vagina. You feel like, okay, let me go to the pharmacy now and get drugs. Instead of, meeting up with a doctor, a gynecologist preferably, instead of you to, go there and, talk to a gynecologist, you decide to treat yourself. Now, one thing you don't know is that you don't go to the counter, that's to the pharmacy, and buy any type of antibiotics for treatment. Sometimes some vaginal infections are not even caused by bacteria. Some are caused by fungi, some are parasitic, and so on. So it's not every type of infection you have that will be treated by same particular drug. Okay, because some of you feel that every infection you have, you must go and get flagyl. Every infection you have, you might go and get this, you might go and get this. Now, it is very, very wrong, because even the antibiotics you are getting, some of these antibiotics are actually bacteriostatic, okay, and some are actually bactericidal. Now, what is bacteriostatic antibiotics? They are antibiotics that prevent the growth of bacteria. Now, bactericidal antibiotics are the ones that totally destroy the bacteria, that it kills the bacteria. Now, I don't know if you know that you have a normal flora called Acidophilus lactobacilli inside your vagina. It was put by God to prevent, any form of infection coming into your vagina. Now, ask me why God had to put a bacteria in our vagina. It's a normal flora. It's there to protect your vagina from any form of infection. So imagine you going to the counter, buying any drug, and then that bacteria happens to be, that particular antibiotics happen to be a bactericidal or even bacteriostatic, that now tempers with your vaginal flora, and then your vaginal flora that's supposed to be growing and protecting your vagina will now stop growing and probably killing that particular one. Sometimes some of you go to the pharmacy and they give you certain drugs to put inside your vagina. Be very mindful, because one, you have to even run a test. That's why you need to see a gynecologist. You have to run some tests. It's when you talk to a gynecologist that he will know if okay, this is your case. You have to run a test before we give you a drug. Oh no, this your case is known and we can treat you like that. But mostly they will tell you to go to the laboratory and run a test. They can tell you to go for HVS, which is high vaginal swab, and they can tell you to go for ECA, which is endocervical swab, and other microbiological tests that will be conducted on you. So please do not treat yourself by yourself. Now, another reason why you keep having these infections in a year, a woman will have infection up to like 5 times, 6 times, is because you don't treat your partner. You self-infect yourself. Some of you, after having this infection, yes, you know that you slept with that fine boy, you slept with that fine guy. Oh, this guy, I like him and all that. After sleeping with him, it can even be your husband that probably brought infection home, and as a woman that, oh, you've gotten this infection. Then you quietly go and treat yourself, because you feel that, oh, you're smelling down there, you're itching down there, and you don't want to tell your partner, and then you quickly go to the hospital and treat yourself. And then when the doctor will tell you, madam, this infection is something that can be sexually transmitted, we will have to call your husband or your boyfriend over, and you tell him, okay, I'm going to call him, and then you take your own drug, go and quietly be taking your own drug, and don't call this person. And then after you finally treat yourself and you are very okay with yourself, you go back and have sex with this person. My sister, you are going to get that infection back. Yes. So some of you, the reason why you keep having infection back to back is because after treating yourself, you don't treat that guy, you go back and have sex with that your partner again. Now, another reason is also that if you're having different sexual partners, let's say you're having 5, if you're having 5 sexual partners, let's say, girl, you're dating 5 guys, you see, even when you treat one, you don't know whether you have given it to that one. So imagine calling 5 guys to the hospital. How are they going to see you? You get the point? So do well to treat your sexual partners, okay, when you're treating yourself, okay? It's not a thing of shame, just treat your partner too. Now, the last one I'm going to talk about is that the fact that you don't complete your drugs. Yeah, some of you, When you finally go to the hospital, you meet with your gynae and they prescribe drugs for you. And then after taking maybe this antibiotics was for 5 days. Maybe after taking for 3 days, you notice that the smell has stopped. You notice that the itching has stopped. Your vagina is now brand new, smelling nice. And all of a sudden, you just tell yourself you're not taking this drug again. You're feeling better, and then you go. You don't know that. See, you are causing antibiotic resistance to yourself, because at the end that infection is going to come back, because this drug has not totally killed the bacteria. Now, how am I going to explain this? When you shoot somebody and this person like passed out or fainted, let's just say the bacteria only fainted because it's going to stand up, or maybe plenty that you are supposed to kill, you killed only some and some are still alive. You get? So that is why this bacteria, they have a dosage. Okay, so if you don't complete it, you're harming yourself. You are just harming yourself. So please, whenever a drug is given to you and they tell you this drug is for 6 days, 5 days, please do well and take it accordingly, because these are the things that bring these infections back. And some of you keep smelling down there and you keep washing, and every time you're treating yourself. And when you overdo it, when you overtake drugs because of infection, you might even cause other issue to yourself. So guys, I believe that you enjoyed this topic. If you enjoyed this topic, please give this video a like, thumbs up, subscribe to my channel and follow my page. Bye guys.